Hi guys, welcome to another infectious disease video. This is going to be talking about typhoid fever, so let's just jump right into it. So, for typhoid fever, we have our scientific name, which is Salmonella entericus subspecies Entericus cerebar typhi, otherwise known as enteric fever or slow fever. For our nomenclature, we're going to have Salmonella entericus cerebar typhi, or S. typhi, or just typhi. An older name for this would be referred to as Typhus abdominalis or Bacillus typhosus. These names over here, they might seem weird, but I assure you they're supposed to be capitalized. So here's our beautiful gram-negative bacillus with a patricious flagella and a V capsule and a lot of fimbriae. And here's more about it on this side. Yes. But we're going to go into that later. So, we're going to be talking about 6, not 7 types of novel strains of typhoid fever. And all of these strains are caused by poor hygiene and sanitation. They're also going to be located in low or like middle income areas such as Southeast Asia, Sub-Saharan Africa, Latin America, and it can also be caused from like contaminated water. So for our first one, Salmonella enterica serotype typhi, otherwise known as RS typhi, paratyphi A, and paratyphi C, they're going to only be pathogenic to humans. Unfortunate, I know. We're the victims in this case. Anyways, for paratyphi B, this is going to be a systematic infection, which means it's going to affect the deoxygenized blood cells or blood in your circulatory system. We also have our MDRs and we have our XDRs. XDRs are usually going to be found in the Pakistan region, specifically the Sindh province. Okay, so we have our taxonomy here, which is going to help me explain why S. typhi is going to be S. typhi. As you can see, our genus is going to be Salmonella, and our species is Enterica. But as we go into Enterica, we see a bunch of subspecies. So what we're going to be focusing on is going to be the subspecies of Enterica. So Salmonella enterica. And as you can see, there are serovars, non-typhoidal and typhoidal. We're going to be talking about typhoidal. So the name typhoid, the name Salmonella typhi comes from its genus and its serovar instead because of how much bacteria that are connected to it, and because this is a specific serovar that causes typhoid fever. So for our diagnosis, we can't really diagnose typhoid fever because of its similar symptoms and signs, such as having stomach pain, chills, tiredness, weakness, muscle aches, loss of appetite, or having a lasting fever up to 104 degrees, a swollen stomach, nausea, vomiting, constipation, or diarrhea. In long terms, you can either have a rash within your abdomen, your chest, your lower chest, your back, or your upper arms. So, some tests we are able to run are rapid tests, which are fairly inaccurate, but is available to everybody. We have our blood cultures, which is pretty immediate and accurate, especially within the first week of contracting typhoid. We also have stir urine that's used whenever the blood culture is negative. And this is better in like long term. And we also have the bone marrow culture, which we are able to use whenever it's urgent and if it's like unclear if you have typhoid fever. So this bone marrow test is able to avoid antibiotics, so you're able to detect Salmonella typhi. So here are the rashes. It looks painful. So now we have some treatments. We're mainly going to be using antibiotics. So what we're using is ampicillin, which is going to be used whenever the strain is non-resistant azithromycin is going to be used whenever it's non-resistant, and ceftriaxone is going to be used in like urgent matters, like first line in the hospital. So now we have our supportive care, which is oral and IV rehydration. Since none of us want to dehydrate if we contract it, I hope we don't contract it. But for people who did contract it or who do have it, you want to drink a lot of water because you don't want to dehydrate from diarrhea or a fever. Nutritional support is going to be there to help you recover. And we also have corticosteroids that are used in severe cases whenever there are neurological symptoms or whenever you're in shock, like that. So we also have asymptomatic carriers of typhoid fever, and that S. typhi would be found in their gallbladder. So what we can do is to use long-term antibiotics or cholecystectomy, which is just removal of your gallbladder. So for our vaccines, we have 2 of them, one inactive and one live vaccine. So usually these are administered before you go travel internationally. They're administered either 1 or 2 weeks before you leave or travel, or if you're susceptible to the disease, they have a specific time and specific schedule used in order to whenever you need to take this. If you have this disease, or not disease, if you have this vaccine, it is very important that you refrigerate it and don't freeze it because it will die. So please refrigerate it. So we also have why S. typhi is so infectious. So first of all, it has his typhoid toxin, subunit A and subunit B. Basically, this is your dad asking you to help around the house, but instead of fixing things, they're gonna be breaking things. So subunit B is gonna be you. It's basically like the receptor proteins helping bind to the host cell in order for subunit A to go in and damage and kill the cell. This one's usually found in S. typhi and paratyphi A. So next, we're going to have our fimbriae. It's going to be adhering to epithelial cells within your ileum and your small intestines. And it's also going to have effector proteins. This one actually, S. typhi actually has a specific protein called STOD. And it's gonna cause the ubiquin within your body to be abnormally distributed. You don't want that to happen. We want everything to be evenly distributed. And since our bacteria, or S. typhi, is gram-negative bacteria, it's going to have liposaccharides. And these LPS can worsen your infection symptoms. So now we have our V capsule. Our V capsule assists in evading the immune system. It's gonna evade macrophages, along with dampening the intestinal inflammation by preventing TLR4, because TLR4 assists in signaling the immune system to come and kill stuff. And the V capsule is able to evade macrophages as lysosomes aren't able to break it down. And T3SS is basically just having the effector protein directly inserted into host cells. Okay. So, for obviously our bacteria, it needs to infiltrate the ileum, as I said before. And other areas that are going to be infected are going to be your liver, spleen, bone marrow, and your gallbladder. So, how this is transmitted is through the oral fecal route, or vehicle transmission, or contact transmission. As you can see from here, eating shellfish from sewage contaminated water, contact with household items, having surfaces contaminated with Salmonella typhi, or handling foods or drinks prepared by an infected person. This sounds a lot like contagion. Let's not let that happen. Some entry routes are going to be through your skin, through your mouth, nose, GI tract. Yes, sorry. And why should we care? We care because there are around 5,700 cases that are reported each year. Worldwide, there are around like 9.2 million cases with a bonus of 110,000 deaths. I don't want people to die, and I'm pretty sure you don't want people to die too. So I consider that really bad. And then this is like the leading cause of death in a lot of like low income areas or like countries like that. So we also have epidemics and pandemics in history, such as the Spanish American War. We also have Typhoid Mary. She was an asymptomatic carrier that was linked to 100 cases of typhoid in New York. There's one recently in San Antonio, Texas, 1981. It was confirmed that it was typhoid fever, and there were 80 verified cases. In Tajikistan, there were around 108 deaths that were reported. And in DR of Congo, there were over 200 deaths. Right now, currently in India, Jorhat, Assam, there's still ongoing epidemics going on. So, who are at risk of typhoid fever? So, low income areas are obviously at risk as they do not have the they don't have availability or access to having better hygiene and sanitation. And people who are like around young adults or anyone younger than that are also at risk to typhoid fever. So basically, your 2-year-old nephew has a better chance of getting typhoid fever than your 80-year-old grandma. Okay. So, thank you. Thank you for listening to this presentation. Please hit that like and subscribe button. And thank you.